Can a brow lift fix hooded eyes? The goal of a brow lift is to lift the thicker skin of the eyebrow off of the thinner skin of the eyelid. If it's well done and not overdone, a brow lift will fix brow hooding, but not eyelid hooding. What most people think of as hooded eyelids are one of two things. Either the eyelid itself is down on the globe, it sits low on the eyeball, the globe, or there's extra skin there. Brow lifts help a little bit with the extra skin. A blepharoplasty, an upper blepharoplasty, helps redundant and excess upper eyelid skin the most. But it doesn't help, a brow lift doesn't help ptosis of the eyelid. So if here's your eyeball, and here's the eyelid, and the eyelid sits too far down on it, a brow lift won't help that. In fact, in most people with ptotic upper eyelids, droopy upper eyelids, their brow on that side is a little bit higher to try to compensate. So if you look at a lot of people with ptosis of their eyelid, they'll have three things. The eyelid is droopy, the sulcus is deep, and the eyebrow is high, and it makes for an unpleasant or an unnatural and not ideal appearance. So what we often do with that is fix the ptosis, and that gives fullness to the eye, and the eyebrow actually drops a little bit because it's not super high eyebrows that are good in everyone. So we want the balance of the eyebrow higher but not too high. And in people with ptosis of their eyes, ptosis of the eyelid, the brow is often very high. So will a brow lift open your eyes? Not if you've got ptosis of the upper eyelid. And then the next thing that people ask is, what age should they get a brow lift? When should they do it? I think it depends what you have. Some people, their eyelids begin to age at very young ages. I got retinal surgery on my eyelid many years ago. It stretched my eyelid, and I have a little bit of ptosis of this eyelid. And that's why the brow on this side is a little higher. It's a compensatory mechanism. And if you look closely and you diagnose people carefully, you can correct these asymmetries. You can correct the things that make them look tired or aged. And that may be a brow lift, upper eyelid surgery with ptosis repair, any of the above. I'd like to diagnose you. I'd like to hear your questions. Email me, call my office. I look forward to seeing you. The consultation is the best thing to have me look at you and diagnose you and then suggest. What you do is your choice. I look forward to seeing you. Thanks.